We are going to be looking at clearance substances. So the first one we have on our list is inulin. We are looking at inulin clearance. It's a procedure by which the filtering capacity of the glomeruli, which is the main filtering structure of the kidney, is determined by measuring the rate at which inulin, the test substance, is cleared from the blood. Inulin is the most accurate substance to measure because it is a small inert polysaccharide that readily passes through the glomeruli into the urine without being absorbed by the renal tubules. The steps involved in this measurement, however, are quite evolved. Consequently, inulin is seldom used in clinical testing, although it is used in research. Now, we have said so many good things about inulin, and we said it can be used as a clearance substance. Yes, because it has some advantages. And here for the advantage, we said it is a small inert polysaccharide that readily passes through the glomeruli into the urine without being absorbed. It has some good qualities. See some qualities of inulin that we have mentioned, but yet, for some reasons, it is not being used in clinical testing. Some of the reasons are because it's more invasive, and also it is more expensive than creatinine. It is more expensive than creatinine. So for some of those reasons, we don't use them in clinical testing. Now, creatinine clearance is the more common procedure used to assess renal function. So among inulin and creatinine, the best for now that is being used to assess renal function is what? Creatinine clearance. Now, the average rate at which substances are filtered out of the plasma, GFR. Remember, we have talked about GFR before, glomerular filtration rate. Now, the average rate at which substances are filtered out of the plasma, GFR, is about 75 to 115 ml per minute for women and 85 to 125 ml per minute for men. The rate decreases with age. So as the age increases in a woman, it decreases, it goes below that 75 to 115. For men, same thing, as the age increases, as the age decreases, as the rate decreases with age. So as the person is aging in men, the GFR decreases. So it goes below that 85 to 125 ml per minute. Now, it is markedly reduced in such conditions as 1. Acute glomerulonephritis, also called Bright disease, which is characterized by inflammation of the small vessels that loop through the glomeruli. So when there are some disease conditions associated with glomerular filtration, of course, you will expect that it will be markedly reduced. That the GFR now will be markedly reduced. The clearance rate of the creatinine will be markedly reduced. So we have talked about inulin clearance, and we have also we said a little thing about creatinine clearance. So we said creatinine is inulin would have been the best clearance substance to use, but because of some factors like it being more invasive and being too expensive compared to creatinine, so it's barely used or seldomly used in clinical testing, except for research. Why creatinine is being used in clinical testing? And we said creatinine for now is substance of choice for clearance to determine or to check for renal function. So we move to another topic. The topic is dilution and concentration tests. Dilution and concentration tests. Here we also talk about urinary acidification tests, and by God's grace, we'll call it an end. We'll also look at urine-specific gravity/osmolality. So, see you in my next class. Bye!